see whether the MPI was unambiguously higher or lower in all possible pairs. These are the 5 South Asian countries. We need to bear in mind that Pakistan does not have nutrition and Sri Lanka does not have enrollment. So there, in Pakistan, mortality receives the full health weight, and in Sri Lanka, years of education receives the full weight of the dimension. Still, we see that Nepal is clearly the poorest. Sri Lanka is the least poor. But for example, India and Bangladesh cross there. So this suggests, for example, if that one was to assign aid help to these 2 countries, one should not give more or less to these 2 based on just a slight difference in the MPI in this case. In some other cases, the result may tell the opposite. For example, Latin America, there seems to be more of a dominance between the Latin American countries, with Haiti being the poorest, followed by Bolivia, and then Belize, Dominican Republic, Colombia, and Peru. So this is the type of analysis we are still working on, and in all the possible pairs of countries, we found that out of that all total number, 95% of the comparisons are unambiguous between K2 and 4. And finally, there is also the robustness to weights that has caused so much debate. Of course, weights are a normative decision, but still one would like to know how much results change. So this is just one very first example for India. This is the baseline. We use equal weighting for the 3 dimensions, a third, a third, a third. But then there is the possibility of giving, say, health 50% of the weight and the other 2 receiving 25% each, and the same with the other 2 dimensions, switching them around, giving education 50% and 25% to the others, or living standards. So the question is, how does the MPA changes, and how does the ranking of the Indian states change? And of course, as it happens when you change the indicator, the MPI estimate itself does change. With the equal weighting, we get an MPI of India overall of 0.296. When we weight health with 50% of the weight, we get a slightly higher MPI of 0.302. When we weight education more with 50%, we get a smaller MPI, and when we weight living standard more, we get the highest MPI. And there is a range of variation in the headcount too. For example, Kerala's headcount varies from 16% to 20.5%. The headcount in Bihar also varies from 74 to 86. But again, the question is whether the states, the ranking of the states is robust. And again, we find that even with quite a significant rearrangement of the weights, the correlations between the Indian states are quite high, are about above 0.96 using Spearman, above 0.85 using Kendall. So I guess that the idea is this is a very important exercise to do, but probably for policy recommendations and follow-up, one needs to make a decision on the sets of weights and do the follow-up using that, and do the robustness as a check. But there has to be a decision on the weights. Other ongoing analysis we are doing, we will bootstrap the estimates. We will do the robustness to weights for all the countries. It's just that we've been quite busy lately, and we also want to explore the household size effect, as some indicators are more biased towards having children in the family or having female in the family, and so on. And let me say that we brought some brochures with the summaries of the studies that we would like you to take. So we will be distributing those.
Thank you.
And the final thing we just wanted to share in 2 minutes is some of the questions that we are facing, that we anticipate others are facing, and that we would very much welcome collaboration, methodological input, discussion on. The most common pushback that we have had is why don't you include this variable for the MPI? Why don't you include a variable that will allow us to disaggregate by gender? Why don't you include empowerment? Why don't you do something better than child mortality? So the data constraints come very front and central. And so there are a number of questions about perhaps having new questions that would be in income expenditure surveys, individual level data where we only have information for one respondent from a household, or combination of household survey data and administrative data, poverty mapping techniques. And also there's the question which is inherent in this approach of child data versus adult data. And how do you combine data for different reference groups? Do you do it the way that we have done it using a household? Do you have child-specific surveys? But there are a number of issues around that. There are a number of issues around both the international MPI and about the implementation of national measures. And I've just put a few of them down. The robustness test that Mariama put, improving any indicators, any suggestions that come forward to improve the existing international MPI or to generate one for other countries. In national measures, I think we will have much more leisurely discussion on that, but there are, yeah.
One suggestion is, why don't you leave this up here, and
Okay.
I'm sure you'll have these things come up in the
Okay.
question and answers.
Okay.
Yeah? And so we can move just to allow a lot of questions. Which
Okay. And then the last slide was just there's also some research questions, both in the methodologies of developing test statistics, developing a proper robustness test, and then in the analysis and the econometrics of looking at when you have a left-hand side variable, which is multidimensional, then you have a lot of endogeneity issues, you have a lot of issues in terms of the analysis that proceeds. Thank you.
Thanks. So before we go to the Q&A, I think Jaime would like to introduce Jenny.
No, yes, just very
Who is not on
quickly. One of our, I would introduce one of our participants who's Jenny Klugman, and she's behind many of these efforts that you have seen today. Jenny is now director of the Human Development Report Office in UNDP in New York, so you're lucky to live in New York, Jenny. And she's director and lead author of the Global Annual Age Human Development Report, and she's on leave from the World Bank, so that's why many of you know Jenny very well. So Tara, please.
Okay, so the idea here is to ask a lot of questions. When you do, if you would like one of them, any particular person like James, Maria, or Sabina to answer, just indicate that. Briefly introduce yourself and ask the question very precisely. Thanks. Who goes first? Before we actually, just hold on. Before we go here, let's go to the field. Let's go to Brazil. Any questions?
Yes, just like a quick question to Sabina. I think you probably have received this before, but like something that particularly makes me think is the use of this child mortality component for the health indicators. Not particularly because of the measure, but since you asked, like, if anyone in the family like has faced this will generate persistence in the index. So, like, as James Foster has mentioned, that one of the key motivations for moving to a multidimensional index would be to assess, like, the impact of policies that would be reflected on income poverty only in a long time. Like, if you ask, have any child in this family die, like, this is not gonna change for this family ever. So maybe I was wondering if you couldn't use another question, like over the last 5 years, I don't know, just to see if this also can be tracked in time and to assess improvements in this dimension of the index. Thank you.
Okay, can we collect a few? And so Kenya, any question? The Kenya office?
Not now.
Not now, good. Anyone else connected? Mauritius. Mauritius, any questions? Mauritius, any questions? I think they left. I take that as no. Okay. So now let's turn to, now I think they fell asleep.
Is Uganda?
Oh, Uganda, sorry,
Is
Uganda.
Uganda.
Any questions?
It's on the
Yes,
phone.
I just wanted to ask whether on the robustness checks, they try to find whether the MPI, as they did it, doesn't understate poverty in households that don't have children. Because in most of those households, then they are deemed not deprived in all those dimensions related to children.
Okay, so thank you. That was Andrew, I think, no? No, thank you, sorry. Oh, so anyone else connected by audio? Any other country connected by audio? Okay, so let's move to Washington here and let's take about 3 more. Let her answer and we'll go to the next round. So who goes first here? Oh, she actually, okay. Yeah, go on. Speak into a mic. If you could come and speak into a mic so people in the field can hear you.
My name is Adriana Cardoso, and I'm working for the Poverty and Gender Group. And I was wondering whether, in Latin America, and I was wondering if, or why you are only using normative weights, and whether you could expand a bit more on that, and whether you are using also statistical procedures to corroborate your results, particularly for robustness checks. I was also wondering what you think about, or if you consider that it is important once you move a bit away from creating a comparable index for each country to have different weights according to different needs. Thank you.
Ampar? Yeah.
Thank you. My name is Amparo Vallevian. I also work in a LAC Poverty and Gender Unit, and my question is addressed mostly, I suppose, to Professor Foster, but anybody else. In the deprivation matrix, you analyze mostly the statistics having to do with individuals, that is the rows of the matrix. But mathematically, it's possible to do exactly the same along the columns and to focus on dimensions, or in our normal parlance, sectors of intervention. And it seems to me that for a national policymaker, that may be a more relevant analysis, because it's many of the problems that we are dealing with here are very similar to the problems with governance indicators and the aggregations of different dimensions of governance indicators. And there they have coined a word called actionable indicators, meaning those that can be influenced by a policymaker. And it seems to me that along the columns, it's easier to influence than it is along the rows.
Okay, one last one here and we'll go to.
Thank you, and thank you for the presentation. I just want to ask, I'm going to ask 2 quick questions, sorry. The first one is, I am a little bit confused because you keep talking about individuals, but you're really measuring this at the household level. And all of the individuals are considered poor if they live in a household where, for example, one child has died and not enough children are going to school at the right age or something like that. And so, and that's our classical approach to poverty, is that's, so I'm just wondering why you keep talking about individuals when it's really households. And obviously, that relates to I will certainly be interested in the household size effects, things that you're working on. Obviously, that's going to be an important question. And then the second thing is, I completely understand your pragmatism of basing it on what we have. Although, I guess some 25 or more years ago, when the LSMS project was started, people did ask, what should we have? what are the most important things we need.